Hey, this is Dr. Mark Richard, orthopedic surgeon at Duke University. And today on Diamond Doc, we're going to talk about scaphoid fractures. So what is the scaphoid? The scaphoid is one of the 8 small carpal bones of the wrist. The carpal bones are located between the hand and the forearm, and the scaphoid is located below the base of the thumb. The carpal bones are separated into 2 rows, and the scaphoid has a unique position in that it crosses both rows. This puts it at particular risk for injury because of the complex mechanics of the carpal bones. The scaphoid is by far the most commonly broken of the carpal bones. It is shaped like a peanut, and it is coated almost entirely in cartilage. So how does the scaphoid break? When the wrist is extended to 95 degrees or more, the scaphoid becomes fixed against the radius, and when someone falls onto an outstretched hand in that position, the scaphoid can break and cause pain and swelling on the thumb side of the wrist. In baseball, this can occur in many scenarios. It can occur from the impact with the base in a head-first slide. It can happen from the weight of the body landing on the wrist in a standard slide. Or it can occur from a collision with another player or the wall. These injuries can be difficult to diagnose. Often players will think it is a sprain and may not seek treatment initially. Furthermore, scaphoid fractures can be hard to visualize on x-rays. Oftentimes, the initial x-rays are negative, and sometimes a CT scan or MRI is required to see the fracture. The other challenge of scaphoid fractures is that they are difficult to get to heal. The healing potential of any bone is related in part to its blood supply. The scaphoid is supplied by a single blood vessel that runs from the far end of the scaphoid upstream to the near side. This blood vessel is disrupted by the fracture and may compromise its ability to heal. Depending on how and where the scaphoid breaks, a fracture is either treated in a cast or with surgery. A cast may need to be worn for 2 to 3 months. And if the scaphoid fracture is displaced or broken apart, surgery is warranted. It is typically treated with a screw placed across the fracture. Sometimes, even in a non-displaced case, an athlete will choose to have surgery to shorten the healing time. Overall, about 10% of fractures will go on to non-union or fail to heal. In these cases, surgery is required to get the scaphoid to heal. This can be prolonged and challenging, so great attention is given towards getting it right from the start. If you have wrist pain after an injury, be sure to be evaluated by a healthcare professional and make sure that you aren't missing a scaphoid fracture. Do you have other questions about scaphoid fractures? Please respond in the comments and ask your questions using the hashtag USAB mailbag.